Hi, my name is David Tenner of the Goldberg Clinic for Chronic Disease Reversal located in Atlanta, Georgia. And today I'd like to present an interview of a patient we've been working with for the past few months. The patient had been to numerous medical doctors and neurological specialists, but was not given any medical diagnosis or plan of care. The patient presented with symptoms including pain, numbness, tingling, and weakness, as well as chronic fatigue and digestive issues. The following interview is a detailed account of the patient's experience with us at the clinic and the significant improvements that she has seen while under our care.
Hi, this is Dr. Paul Goldberg of the Goldberg Clinic. We're here today with Mr. and Mrs. Murray. Mrs. Murray has been a patient of ours for 2 or 3 months now, and we're here to tell her story about her improvements at the Goldberg Clinic. And Ilka, you came in to see us, I believe, in, was it June, I believe, is when you first came in. We got you started on the program in July.
Yes.
And it's now mid-August. And in just the past 30 days, you've had some significant improvements. What kind of problems were you having when you came in to see us just 2 months ago?
Dr. Goldberg, I was having numerous problems. Swelling, numbness, pain all over my body, pain in the stomach, my legs, my head, my hearing went out, just anything that you could think of. I was having problems. I was tired. I had no energy to do anything, to get out of the bed, to go play with my children, to cook.
And your kids are a couple of real live wires.
Yes, they are. They are. I have a 4- and a 7-year-old. So basically, I was just bedbound.
Yeah.
Going to doctor after doctor. Nobody could find out what was going on with me. And
what kind of doctors had you been to?
Every doctor, specialist, neurologist.
You've been to a medical neurologist?
Medical neurologist.
Yeah.
I've been to a lung specialist.
Pulmonologist?
Yes, my regular primary doctor. Any doctor you could think of, I've seen him or her.
Okay. What had they told you?
Nothing.
You had a significant number of tests.
Right.
Did you have an MRI done?
I had MRIs, I had CAT scans, every blood test you could think of, x-rays, anything that you could, any test that's out there in the hospital medical field, I pretty much had already.
Right. Mr. Murray, was this kind of a frustrating thing for you and your wife?
Very frustrating. Very frustrating because nobody could give us an answer or give us a direction to go in. So very frustrating. So coming to you all and her getting some results was refreshing and some great news to be able to get a doctor that can actually get us some results going on.
Okay. And Ilka, when you came in, we did some functional testing on you. We did a case history. We did a physical examination. Anything peculiar about the program I'm having you do? You doing any special herbs or homeopathic agents? Am I waving any prisms over you? Anything like that?
No, you're not. But what I will say is that you gave me a path and you gave me clear and simple directions to put me on a better life, health life. And you really gave me my life back. It literally is just taking care of your body how it's naturally made up. It's not with all these medications that you can't pronounce. It's not with medications that they cure one symptom but then you get another 5 and you still have the problem at the end of the day. It's literally just taking what your body naturally takes and needs out of food and out of rest and out of having a healthy lifestyle and connecting it the right way and being consistent in it, and it just gives you your life back. So I appreciate that.
So would you say what we've basically done, this is what we do with all of our patients, we basically set forth for you, based upon the problems you came in with,
Yes.
establishing the right conditions of health for you.
Yes. Because here's what happens. You go into a doctor's office and they just give you a little, you know, a little whatever they want to say they want to give you. Here's what you might have. We don't know for sure, but here's what you might have, and here, go take this medication, and if you don't feel better, just come back. And they just keep doing that. It's a repetitive process. But here at the Goldberg Clinic, they actually, you know, narrow down what's going on with you. They take time. You're just not a number here. You're just not a client here, but they take the time to truly care for you here and want to see your health go to the next level. And by doing that, they give you the right supplements and vitamins. They give you the right diet that you need that's tailor fit to what's going on with you, and you see results immediately. You know, in 30 days, my swelling has gone down, my pain has gone down, my numbing is gone. I have energy through the roof. I can get out of the bed. My kids are not asking me anymore, you know, can you get out of bed today, Mom? But they're saying, hey, you know, can we come in from outside? You've had us out here for so long. So it's just totally different, and I just really felt like I was in death's doors. I felt like I was dead and gone and my life was gone. And just doing this, and this is just 30 days. You have to remember, this is just 30 days that I've been doing this. My life is back. And I just want to encourage anybody, if you're down and out, I know how that is. You're down, you're in bed, you can't get up, you're going to doctor after doctor after doctor, and you can't get any help. And this was my last resort, but this is the resort that has given me my life back.
Ilka, thank you very much for that. Those words of encouragement for other people who have similar problems. You're right, there are a lot of frustrated people out there. We just want to let you know that, everybody to know, that it's not necessary to be sick. There are easy and simple ways based on an individual workup that we can do at the Goldberg Clinic to help people get well without drugs and without dangerous surgeries, and again, putting people's health care back into their own hands so that we make health care into self-care.
Yes.
Thank you, Ilka. Thank you, Mr. Murray.
Thank you.